So this is a chest radiograph of an adult female patient presented with some non-specific cough symptom. You do not see any consolidation or any lung lesion on this chest radiograph. However, you do notice that the cardiac apex is located on the right side, the stomach bubble is on the right side, and also the liver shadow is on the left side. But it is not an inverted chest radiograph because of the annotation is truly the right side. So all the objects you just see is really inverted in the position. Okay, so this case is suspected to have situs inversus. Okay, situs inversus. On chest radiograph, we are focusing on two types of the situs assessment. One is called the visceral, which we have already done, mainly focusing on the liver as well as on the stomach. Okay, for the liver, you do not see any bowel loops, and also there is slightly high up hemidiaphragm because of the larger size of the liver, and the stomach bubble in close proximity to the undersurface of that side of the diaphragm. Another one we will call it the bronchopulmonary situs, which is the anatomical relationship between the bronchus as well as the pulmonary artery. So we draw the trachea out, right main stem bronchus, left main stem bronchus, okay? And then we are going to have the pulmonary artery on the right side is inferior to the bronchus, and on the left side is above it, okay? So it's opposite in the anatomical relationship on both sides. So how can you remember which one is above it, which one is below it? Basically, I remember it by knowing that we have the another thing that is hooked around the left main stem bronchus, that is the aorta, okay? So I imagine the pulmonary artery is doing something similar, also hooked around it, okay? So it's above the left main stem bronchus, while it is below it on the right side, okay? So this is a mnemonics you can use, okay? So how can we assess that? That's actually a little bit complex, but the easiest way is try to have a proper windowing so that we can see the tracheobronchial angle better, okay? So we draw the trachea out, and also surely this is the right main stem bronchus, and then we will have the windowing better. Okay, so surely main stem bronchus here and then here. Okay, so basically this is the two main stem bronchus, and you see this is the hilum. So this is the hilum. So the hilum here is above it, okay, above the main stem bronchus, and the hilum here, the pulmonary artery, okay, is below it. So basically it is reversed that we have just mentioned. We will expect to be higher than that on the left side, but now it's lower, and then inverse relationship is also seen on the right side. Now the pulmonary artery is higher up than that of the right main stem bronchus, okay? So basically there is situs inversus involving the bronchopulmonary situs as well. So for a patient with situs inversus, it can be just happening by itself, or sometimes there can be underlying ciliary dyskinesia, okay? Dyskinesia. So basically we have the cell and we have some cilia, and cilia beating is unidirectional. For example, the beating and try to move the water and also some chemical to one side, and that is actually a signaling method for the body during embryological stage to distinguish which side is versus another side. For example, A versus B, okay, we have the due to the chemical gradient which is affected by the ciliary beating. However, if we have ciliary dyskinesia, so such beating is actually impaired, so the body can no longer differentiate between the site, okay? So they may have situs inversus, okay? But having situs inversus doesn't mean that they will have the bronchiectasis, because we always see a lot of us will try to memorize, okay, so when we see situs inversus, we are trying to see any bronchiectasis. Yes, that is the case, because one of the things that we need to consider is ciliary dyskinesia, but the ciliary beating failure actually causing situs inversus, and at the same time cannot remove the mucus from the airway, so they can cause bronchiectasis. So they're actually two different things. You should not say that situs inversus cause bronchiectasis. That's actually not happening like this, okay? But having the similar predisposition, okay, which is caused the ciliary dyskinesia. So do we see any bronchiectasis? Especially this patient also have some non-specific cough symptom, but we did not see any, okay? Basically, that's just some normal lung markings on the lower zones. And we try to see through the diaphragm to see the most inferior aspect, which is not abnormal at all, okay? So maybe just some non-specific symptom may not have any lung changes in this patient.